In New York City, there are over 1 million senior citizens. While enjoying life in one of the best cities in the world, many are still not taking basic steps to help protect themselves. Senior citizens are at a high risk for serious and potentially life-threatening complications from influenza. Here are some stories of real seniors who took action and followed the precautions recommended by healthcare professionals, how they stayed active and enjoyed their lives.
Hello, I'm Sylvia. I live in Queens and I'm 86 years young. I'm not exactly a health nut, but I do eat pretty healthy. I love to exercise, I love dancing, and I like to be active. I play mahjong, I play bingo, and I'm busy all the time. I keep myself busy. It's important for me to be active and healthy. Not only did I have to take care of an elder sister, but I also feel for myself, I shouldn't be a burden to my children. I had a friend and a neighbor, and she got sick with the influenza during that epidemic in the 1970s, and she neglected to see a doctor. By the time they took her to the hospital, she only lived about a week, and then she expired. At 52, it was very sad. Those that don't take the flu shot are ridiculous, thinking they're going to catch the flu by taking it, but that's a fallacy. The 9 years I worked for the doctor, I only got ill once, and it was a minor cold. And over there, I washed my hands because we had a lot of people that came in ill naturally. If the people would wash their hands more often, especially during the flu season, I believe there would be less contagions around at the center and in the subways and so forth. Well, you have to be positive because as you age, you slow down, but you still have to be active. You have to take active part in your community, in your life, in your family, and that's the only thing to do. Sometimes I get stressed, but I try to make healthy choices. I take a walk, I go to the mall, I look for a mahjong game, and I try to be active. If you want to, you can be active.
I'm Doreen. I'm living in Brooklyn. My age is 82. I like to cook, go for a little walk when I comes in back, you know, always try to keep busy. Every year, I do suffer with pains in my body, coughing, sneezing, and weakness. And when I goes to the doctor, he would turn and says, you know, you get coming down with the flu. And he said, you have to get the flu shot. And I said, doctor, you know, I've heard so much about the flu shot. I don't think I want it. He says, Doreen, please, I am begging you, take the flu shots. With your complication, it would do you very good. So I decided to take the flu shot. And it's 4 years now. I'm flu-free.
Take care of yourself. Wash your hands often with soap and water. Use a tissue or the inside of your elbow, not your hand. The influenza vaccine is available from September through June. If you get influenza, call your doctor immediately. If you or someone you know is not feeling well, keep in touch with each other. Staying connected with friends and loved ones strengthens social support and reinforces hope. For more information about seasonal influenza, call 311 or visit nyc.gov. That's nyc.gov.